It is my distinct pleasure to introduce Sandra Elizabeth Roelofs. She is a Dutch linguist, speaks Dutch, French, English, German, Russian, and Georgian, and was the First Lady of Georgia from 2004 to 2013 when her husband Mikhail Saakashvili was president. They met in 1993 in Strasbourg and later moved to New York for a couple of years. And then they moved to Georgia, where she worked for the International Committee of the Red Cross and the Consulate of the Kingdom of the Netherlands in Tbilisi. She's the author of an autobiographic book called The Story of an Idealist, and maybe sometime in the future we'll have an opportunity to have her tell us about this story. In 1998, she founded the SOCO Charity Foundation, which focuses primarily on implementing programs funded by Western European Georgian companies and individuals, and is aimed at supporting low-income families. Since 2007, SOCO has been actively involved in reproductive health and child welfare. During her time as First Lady of Georgia, she was a Stop TB Partnership Ambassador, as well as a Goodwill Ambassador, promoting Millennium Development Funds goals for WHO Europe. Beginning in 2009, she served as chairperson of the Steering Committee on Black Sea Countries Coalition on Breast and Cervical Cancer Prevention. She also established prenatal screening programs in Georgia, promoting prenatal health awareness concerning rare diseases, safety belts, healthy lifestyles. It is my pleasure to introduce Sandra, who is willing to provide her experience and leadership to some of the issues that are being faced in Ukraine. Sandra.
I started with languages and humanitarian aid with the Red Cross, ICRC. Then I wanted to go to Somalia with the ICRC to spread international humanitarian law as a dissemination officer, and I did a course of human rights in Strasbourg for that. And then I met this Georgian there who was going to study in America, Columbia Law School, and who said that, why you want to go to Somalia? It's much more chance for development if you come to Georgia. So I had been in Georgia by chance a year earlier, so I knew what Georgia was, and I was very much impressed by its people, nature, hospitality, etc. So I got charmed, and I took my bags to New York, where we married. And when we had our first son, he became parliament member in 95, yes. And then we moved to Georgia, where I'm now already for 20 years. And I will tell you a little bit about what I've been doing there in Georgia. But everything starting from the health system and the health situation in Ukraine. So whenever necessary, I will draw parallels with Georgia, but I'm not here to speak about Georgia today. As Nadia said, I've been focusing on the Millennium Development Goals, mainly child and maternal health, reproductive health in general, but also rare diseases and infectious diseases. Many of you might know the Global Fund, of which I was a board member for 22 Eastern European countries, also Ukraine. And we have secured a lot of funding for Ukraine to continue to reach out to drug users, to men having sex with men who needed prevention programs, and also to tuberculosis patients. So we've been extremely helpful in securing funding, even till today, for those groups in eastern Ukraine, in Crimea until it was possible, but as you understand, Crimea is now under another kind of jurisdiction, and methadone substitution therapy is no longer accepted. So there's only detox, I guess, and there is no way to have a more modern way to approach drug addiction or substance abuse. when I got involved as a First Lady under Saakashvili, as Nadia said this morning, she served as a First Lady under Saakashvili. I like that a lot. Literally, yeah. And that says it all. So, in fact, I got involved in these public health issues, and I thought I didn't have enough medical background, so I did a course. I got trained as a nurse, worked in the delivery room, in the palliative care hospice, learned a lot about the problems and issues there and the differences with the Netherlands, of course, many of them. And then just 4 years ago, I started a master program at the London School of Hygiene and Tropical Medicine, which I'm finishing this year, I hope. And that's a master on global health policy. So I had a module last year on conflict and health, which greatly helps me to understand the situation in Ukraine much better. So I wanted to say that the cost of conflict, the cost of war, as it's mentioned in the title, is in fact the measure of welfare loss between the current situation and the situation which could have been achieved in the absence of war. So it's a comparison, the cost of conflict. And it can be translated in many ways. It can be health, but it can also be food security, emergency shelters, as we've already heard, and livelihood. It can have issues of education, but also water, sanitation, and hygiene. We see different, if we put a timeline under the issues I'm just mentioning, under the human cost of war, we can see that there are 3 types of issues. There are the proximate issues, so the immediate issues like water, sanitation, hygiene, food, and overcrowding. Then there are the intermediate factors like displacement, stress, food insecurity, breakdown of services. And when a conflict would take even longer, like the case in Ukraine, then there are the distal issues like environmental vulnerability or like economic stagnation. So I want to say that we had the war in Georgia in 2008. It was, of course, a very intensive war, but it was short. It was 5 days. So there were certain issues that Ukraine now has that we have not, fortunately, have not known. So I want to go to the next slide. I don't know. Somebody pushing a button? Yes, good. Facts and figures. So I guess I have some old figures because I saw that there's already 9,000 casualties instead of 8, and more than 20,000 wounded. More than 1 million IDPs, and as Ambassador Aband also already said, there has been an issue with fraud or alleged fraud, and they're working on a re-registration. I hope that will really be smoothly so that it can continue to be paid out to the IDPs. And indeed, 500,000 children are in need of protection, or they have at least had a traumatized experience. About 200,000 children need psychosocial support. And the UN has indeed, through this cluster groups, has indeed organized psychosocial support centers, as I understood, in the regions where the children have been affected. So that's a good thing, but I think also for adults, psychosocial support is very much needy. You've heard, of course, about the polio outbreak, and to avoid further polio cases, which are, of course, very, dangerous, there should be a vaccination campaign for about 2 million children under 5 years of age. And indeed, the humanitarian response that was launched through an appeal last February, just a month ago, has only been pledged for 15 or maybe now 20%, and we need much more funds I have a figure of 300 million, but I heard just now that 390 is mentioned. So indeed, I would also urge organizations and individuals and governments to make donations. We're talking about the war on one side, but on the other hand, also in peace, Ukraine doesn't have a perfect health system, as you know. Unfortunately, primary health care is almost inexistent in Ukraine, so there's all these vertical pillars and different hospitals of specializations. People go, they have like self-diagnosis, they go to the specialist they think they need. When they have a headache, they go to a neurologist. When can have 10 or maybe even 15 reasons to have a headache. So they bypass very often the gatekeeping role of the general physicians and the primary healthcare as such, which is of course very inefficient. And there was an attempt in 2000 and then again in 2010 to make changes in the primary healthcare in Ukraine through reforms, but well, the events hindered the development thereof. Unfortunately, Ukrainians do not have very healthy lifestyle. Many men smoke, almost half, 6% of the women. There's obesity, high blood pressure, alcohol use, or I should say abuse. Life expectancy, the women do better as always. Men 66, women 76. But of course now with the war these figures have to be adapted. Maternal and infant mortality rates are too high. So maternal mortality rate 32 per 100,000, and the infant mortality rate is measured per 1,000, and that is 9. For example, in the Netherlands it's 1 point something. There is a beautiful national health reform strategy written by a Georgian Minister of Health of Ukraine now, Sandra for the period 2015-2020. I've gone through it, and it's really a very nice and idealistic health system description, which is implementation focused, outcome oriented, and hospital-centered, patient-centered instead of hospital-centered. That would be a big step forward, but again, there's this wall, there is a lot of obstacles, there's corruption. He won't even get to do his reforms because there are too many obstacles in governance, and of course, the conflict, which takes away a lot of budget. Next slide. Melan Verveer already mentioned it. The cost of war is very often borne by the women. If you see the second group, that's called the indirect cost: displacement, destruction, lack of health care, stress, malnutrition, versus the more male direct costs of the war, which is death, injury, human rights abuse, psychological disorders. So, and I agree, of course, with Melan, that the women could play an even bigger role as agents and as a backbone of society, and have more chances to do entrepreneurship. When we speak about humanitarian interventions, I think there are 3 questions we have to answer. So why we do this? We do this to reduce mortality, morbidity, disability. That's clear. What are we doing? So the intervention should be safe at all times, should be of acceptable quality, and should be effective. Of course, effective, it has a result. Efficient, it has a result, and it is the money is well spent. So efficient is even better than just effective. And by using, for example, generic medicines, which are cheaper than the brands, we can use the essential list of medicines to use generic medicines, and then the cost will drop, whereas the quality and the safety don't. And then who is providing the intervention? That's another very important issue. There are mobile teams. I know of the WHO in the conflict regions. There are, of course, parallel health systems, like in the IDP settlements. There's community-based, local partners interventions, which is, I think, the preferential one. And then there can also be private, public-private partnerships. We've heard about that yesterday at the Veteran Affairs, Veteran Affairs here in Washington, and they are really underlining this this option that the private sector and the individual, they can really work together with the government to make things happen and support each other. And then in some countries or in some cases even the military brings humanitarian assistance, but that is a very tricky agent to bring assistance, as there is, of course, the deterrent factor. You know, people are armed who are bringing those humanitarian goods. They might not be perceived always as neutral. They can bring extra risk to the hospital or to the community where they come, as they are exactly armed. So that's something to be avoided. Next slide. So who are the most vulnerable? It was already said by the former panel. Children, aged persons, poor people, minorities, so the Roma people in Ukraine, persons with mental, physical or psychosocial disabilities, and men having sex with men and other sexual minorities, and IDPs. Next. Oh no, that's one too far. No? No, it's good, sorry. I got one too far. So now the triad. So this is, when we speak about vulnerability, we can ask ourselves, why are people more vulnerable in a conflict situation? First of all, there's the host factors. So let's say the patient or the person itself. During conflict, there's more stress. During conflict, it's harder to get food. During conflict, vaccination campaigns might be suspended. So there's a lot of factors that immediately affect the host and makes the host less immune or more vulnerable, less resilient. We go left down, that's the agent factors. Bacteria and viruses are very happy in conflict situations because there is lack of sanitation, they can multiply, there is interrupted regimens of drugs. People with chronic care, for example, they all the time need their pills every day. If the medical supplies are interrupted, they are in trouble. And then, if we speak about antibiotics, there can, of course, be a resistance towards those drugs, and that's all part of the agent factors. And then the third is environmental factors. So if the environment changes, like there's overcrowding in a camp, for example, the shelter conditions are, there's no ventilation, or the persons are living close to waste disposal. So these are all environmental factors. So keep in mind those three factors when you talk about vulnerability. Next. I like this a lot. This is the building blocks of a health system. The WHO always speaks about the 6 building blocks. So you can see it as a wall, and the cement is in fact the interdependence between those different bricks. So if we just have the bricks and there's no connection, then the wall will fall apart anyway. So we need to see the interconnections between the different components of a health system. So the health system, first of all, human resources. That's the healthcare staff. We need staff. Yeah. Second, health financing. We need budgets. It can be from the insurance, can be from the government, can be out of pocket. Yeah, out of pocket. Sometimes formal payments, sometimes informal payments. So it depends who is paying for health. Then we have the information systems, just as important. It's important to know how many children under 5 do I have if I start vaccinating them. You have to be able to pop it up from your IT system. So information system is unfortunately very weak in Ukraine. E-health is not as good as non-existent. So this is another very important building block of health care systems. The fourth one, supplies, yeah, disposables, drugs, anything, needles. The fifth one is the service delivery itself. So what kind of services do we offer to our patients? And then this last one, and maybe the most important one, is governance, leadership. We need, and I heard it today several times, also this morning at the round table, it's very, very important to have political commitment. So if you want to build a health system or improve a health system, it should be a priority. It should not be that, no, first defense, first internal affairs, first education, and then in the end, if there's some money left, we'll move to health. No, it should really be politically committed to work on health. In this context, I want to mention, because at all these building blocks, it's very bad to have corruption. You can imagine if you have to pay more for the services than you are supposed to. If you can't get through your medicines to the eastern regions because there are block posts and they ask for money. That's in conflict, but also in peace it happens. If you have to lobby for budget for your interventions, and you have to pay bribes or to win a tender or something like that. So at every of these building blocks, corruption is a devastating factor. And it's important to understand that conflict and poverty is interlinked, is in a vicious circle with corruption. If there is more poverty, there will be more corruption because people need extra money. Nurses can't live on 100 euros a month. If a child is born, they will, take extra money. And if the nurse gets poorer, she will take more. So poverty is linked with corruption, just as conflict is. Conflict is also linked with corruption. If there's more corruption, people want to rebel. So the conflict will be more. It will be expected that there can be a conflict, and when there is a conflict, of course, the situation is tricky. It's insecure. That's an ideal source for corruption. My husband always said about corruption, people have nice definitions about corruption, like is misuse of power and of your state influence or something like that. But my husband always said corruption is very simple. It's when a very talented person comes to the community and there is no place for this person. That's corruption. No place in the institute, no place to get a job, no place to, to start a research project or to write an article. So that's what corruption is. It's when a talented person comes to the community and there's no place for him or her. Next. So this is in fact the same as the last one, but it's less illustrative. This is just to say why we need these 6 building blocks of the healthcare system. We need to improve the health, of course, that's number 1. And it needs to be accessible to all, very democratic. Yeah. Second is responsiveness, so the system should be responsive. When there is a conflict, we should have stocks for that. We should have an emergency plan. We should have an evacuation plan. We should know which persons are the most vulnerable, who goes out first, etc. That's responsiveness. Healthcare systems should be ready for that. The third is financial risk protection, of course. If all the building blocks are in place, but you can't afford it, then if you have an accident and you're not insured, you have to sell your house, sell your properties, take loans, and that's going to ruin your life. So we need a health system to make sure that when you get ill or when you get some kind of problem with your health, you do not have to suffer financially. That's one of the 4 goals of having a healthcare system in the country. And the last is, of course, improved efficiency. So we're learning by doing and becoming more and more efficient through procurement, through all kinds of different schemes, through maybe making things less paper-based and more computer-based, etc. Next. Ulana already said it many times today and yesterday. We always need to plan. We cannot just say that my organization is good at this. In Ukraine there is a war, I'm going to there and I'm going there and I'm going to offer my intervention. No, you first need to assess the health needs of a community, of a country, of a region. You need those building blocks. You need to assess every 6 of those bricks. What's the situation in Ukraine in every 6? Resources, supplies, staff, finances, everything. So those 6 blocks. Plus you need figures. So how many children we have, how many pregnancies a year, how many abortions, how many people with diabetes. You need to have your figures to work, to plan well. But then you need, of course, to know who is there in the field, who is out there, who is doing what. We come back to coordination, what Ambassador Band also said. And then we need to look at those 3 risk factors, which I showed you in the triangle. So the risk factors of the host, of the agent, the bacteria, and the environment. So you have to see if the summer is approaching, for example, you will know that you'll have more infections, yeah, because the temperature is rising, bacteria are multiplying. So you will know that you have you need more interventions or at a larger scale. And then you need, of course, the general context. And that's very important because at what stage is a conflict or a situation in the country? Do we have a ceasefire? Do we still have conflict flaring up? Do we have maybe already early recovery? Or maybe we are already recovering and developing. And in this context, I want to mention 2 very important processes. That's the one of peace building and the one of state building. Now, peace building comes from down. It's bottoms up. So it means that the community has to become more resilient and getting little by little ready and getting used to a normalized situation. That's peace building. So the trust is coming back, the hope is coming back. Whereas state building is a top-down approach. State building is when the government gets little by little hold of the processes. When the government is involved in planning again, in making a budget. So they are more and more involved and trying to give physical and economic protection to their citizens. So in eastern Ukraine, well, is there a government now? I don't know. It's an unclear situation. The central government of Ukraine does not have now any jurisdiction in those regions, so we cannot yet, well, they're somehow in exile, I would say, so we cannot yet involve them in state building, yeah, because those regions are now somehow unclear, and we hope we can get them back, just as the Crimea, and hopefully we can get those people back in power who were there and who were part of Ukraine and who will be helping as actors in the state building process from the top down. I think those 2 processes are very important. When you do a health assessment, health needs assessment, of course your data should be accurate, reliable and unbiased, that's clear. You can, of course, do interviews with the population involved, with the affected communities, and there are all kinds of tools for that, confidential interviews. So when you have assessed the situation, then you prioritize, and of course there comes in the specialty that your organization has. Maybe you work more on women, maybe you work more with children, maybe you work more psychological need or on orthopedics needs. So there comes in your remit, what you have to offer. Then you can plan your interventions, implement them, choose your partners, and then last but not least is the monitoring and evaluation process. So this is very important, and also as Ulana said, you have to from time to time regularly go back to your first data and recheck if all that is still, if a reality check, if it's still the same, or if the formula, the building blocks, the risk factors, the general situation, if anything has changed there, you have to adapt your program as well. So I think we have gone through that. And then, of course, when you don't have the resources you would like to have to make choices. So when there is an intervention planned and you can't raise the funds that it needs, you have to make an essential health service. And that means immunization, of course, one of the main things, prevention of infectious diseases, which can be sometimes very easy by a better hygiene, management of non-communicable diseases, managing of mental health, reproductive health, including gender-based violence. And then if you can offer all these services, for example, in a mobile unit, this is often called the Minimum Initial Service Package, the MISP. So that's what we would call the essential health services in times of conflict. Next slide. Now we're getting towards the end. Georgian Ukrainian relations. I think people know that there's a huge solidarity and sympathy for Ukrainian people from Georgia. And it's like an ally, like a brother. And I wanted to mention here the fact that if the people of a country think, if they think that what they deserve is not the same as what they're getting, then there is a kind of rebellion, yeah? And this rebellion can lead to a conflict. So this is called the relative deprivation theory. So if what you think you deserve is not what you're getting, and we have had that in Georgia as well. Yeah, we've had our revolution, we've had, well, today also it's a very difficult situation in Georgia, so, you know, the temperatures are rising and people are getting unhappy because they think we deserve better and we don't get it, or at least we don't expect it to get it. Georgia has given 12 tons of medical supplies. That was 2 years ago. We've sent many doctors and also combatants. We've also lost many combatants. There was some psychosocial rehabilitation initiatives like holidays in Batumi. And then, of course, the government members from the Georgian reformers team are very present in Ukraine's today's political situation. And not only there are also people from NGOs going to help, people writing articles about health situation and getting them published. It's very important as well. And so if we can improve those Georgian-Ukrainian relations or even bring them up to a higher level, this is an ideal example of the so-called South-to-South cooperation. Because Georgians can very well empathize with the background of the conflict in Ukraine and of the situation in Ukraine, and they can also understand the bottlenecks very well of the healthcare system, because we've also gone through quite painful healthcare reforms. And then the next. So how I see, maybe I can even say my role or Foundation's role in bridging health gaps in Ukraine is maybe in the field of psychosocial rehabilitation for adults, a rehabilitation center for neurological patients, because as you know, in Saki, in the Crimea, there was a very famous and attractive for Georgians as well, for medical tourism. Many people with disabilities went there and unfortunately can't go there anymore. So maybe it's an idea to pick up this need and to do it in one of the Ukrainian cities. Substance abuse is also an important issue, especially alcohol, drugs. Oncological center, that's also what I did in Georgia. I set up breast cancer screening, cervical cancer screening, and very proud that it's still working today. So, as you know, many of the things my husband did are somehow denied and blocked or sometimes even destroyed. But the oncological screening center is still there, the program's there, the financing's there, and I'm very happy that it's something sustainable that we were able to create. Palliative care hospice, maybe it's not at this time the most pressing need, but I'm writing my thesis about that, and I think in Ukraine there's just as much need as in Georgia to give people the terminal phase in their lives without pain, and to make sure that also those who are suffering at home, not only in hospitals, but also those at home, can get access to pain relief and pain medications, often opioids. So to resume, this is the slide, next slide, the humanitarian remit into this Ukraine. So the focus is from an early stage on health system strengthening through those blocks and reconstruction, underlining capacity building, and as I said, from down up, bottoms up, peace building through the resilience of the communities, and state building, top down, increase the government's role in taking back control of physical and economical security of their citizens. And then we can deliver assistance to sustain and re-establish livelihood, but we always have to take into account that this should be impartial, yes, so not politically inspired or not, the hearts and minds. There's a lot of discussion going on in the US as well about that, like, is humanitarian aid politically inspired, ideologically inspired? We have to be very careful about that. And also, we should make sure that what we see in the field when we're delivering humanitarian assistance, we have to report it if it's something that's against human rights. And we should not maintain silence. Well, it's not complete. Maintain silence to maintain access. I think it's important. I know it's very hard. I worked for the Red Cross, so I know very well, to reach certain regions that are in conflict or post-conflict. And then when you finally get there and you can finally do your work and spend your donors' money, then suddenly you see such things that you better be silent about. Because if you don't, or if you give it to the press, or if you talk about it openly, then you might have to withdraw. And I think, and that's also something Olana said in the end, this is something, that we always have to keep in the back of our mind. We have, human rights to protect for all living creatures. And we should think about those priorities first. The last slide which I have is about the referendum. I know it's a humanitarian, of course, panel, but still, like the cement in the building blocks, everything is always connected through politics, and everything is always decided by politics. So I just want to give you a little bit of comment on what's going to happen in the Netherlands on April 6. We'll have a referendum about yes or no, ratifying or agreeing to the EU association agreement with Ukraine. I'm not in the Netherlands on April 6th, but I've given my proxy to my dad, so my voice is not lost. My vote is not lost. But as you see from this caricature, there's big interest at stake. And people in the Netherlands, I think, do not understand enough how much is at stake. So this little fish here, Ukraine, in the middle, it can be, you know, if the European fish is not active enough and not welcoming enough this little fish in their waters, then the shark will take care of it. And that's also what we felt with the map. You remember, those of you who are interested in defense and NATO, you remember that when Georgia wanted to access the membership action plan as a next stage to get closer to NATO, and that was in 2008 exactly, Germany said, no, Ukraine's not ready. No, Georgia's not ready. And of course, when Germany says, then always the Netherlands is echoing. It's like an echo. And France as well, unfortunately. So it was like a carte blanche for the Russians. They thought, okay, if there is no rapprochement between for Ukraine and Georgia towards the NATO, then we'll take care of those countries. And what have we seen? 2008, invasion of Georgia. 2014, invasion of Crimea. So this was all very well planned. And I'm afraid that this referendum is also a kind of game, somehow maybe even imposed game, on the Netherlands, on the Dutch government, to give the Russians a chance to say that, or to set a precedent that, well, you know, Western Europe is not so keen on getting Ukraine in the European Union or getting closer to the European Union. So this is a very important day, and we need to get 30% of the population vote in the referendum. It's not clear if we will get that percentage. So there is a big campaign going on now. There's a yes camp, there's a no camp. And, well, I hope that people will go, will express their vote. The Netherlands, the Dutch government has already ratified this agreement, yes. So if there will be a no, they're in trouble. It's an advisory referendum, I know, but still the Dutch will not let the government get away with it. If more than half of the population that has expressed its vote will say that Ukraine is not welcome at this stage. So now I want to open up the floor for questions. The last slide, please. There's just a few sources, yes, for my information. And maybe back to the former slide, because that's more interesting during the questions. So please, if we have time for a few questions.
No, I'm sorry, Sandra.
I talk too much.
As I said earlier, Ukraine faces many, many challenges, but Ukraine is also blessed the fact that we continue building this Friends of Ukraine network. Mm-hmm. And it is our pleasure to welcome Sandra Roelofs with her life's experience and her leadership to the cause that we're all concerned about. So,
mm-hmm. Oh my God.
As a token of our appreciation, this was crafted by the blacksmiths of Ivano-Frankivsk. Oh, yeah. So this will be a reminder of the work you've done, and perhaps what you are going to do.
Thank you very much.
Thank you.
Thank you.